Welcome back to Face the Jury, a podcast dedicated to confronting the issues of medical malpractice in America, identifying medical malpractice, understanding it, and discussing ways for you to protect yourself and your family from becoming a victim of medical malpractice. Today, we're going to be talking about a case that we resolved a few months ago involving a operating room fire that broke out. Everybody I talked to about this case is sort of shocked that that can even happen. What do you mean a fire broke out in an operating room? How does that happen? And frankly, I'd never had a case like this before. I'd heard about surgical fires, but there are systems in place typically to prevent such a thing from happening. And these clients came to me and they were telling me the story about how their little girl had gone to a doctor with something called a bleb. It's just a little sort of skin growth on her upper eyelid. And a fire had broken out and had caused extensive burns on the right side of her face. And of course, I was absolutely shocked. I'm like, how in the world can that happen? It's even worse, happening to a child in my mind. And we got into the case and we ordered the medical records and sure enough, a fire had broken out. So to tell a little bit about the story, a little bit of background, this was a 13-year-old little girl who had developed a sort of a skin tag. The medical term is a papilledema, but it's a little bit of a skin growth on the upper eyelid. And it wasn't cancerous or anything scary like that, but it would bother her. She was self-conscious about it, of course, because it was noticeable. And it also itched sometimes. And so her parents took her to a eye doctor, and the eye doctor looked at it and said, we can take this off, no big deal. Since it is in the eye area, we want to put her under anesthesia, a light anesthesia, so that she doesn't move suddenly and cause problems with her eyes. So her parents, of course, thought that was fine and supported it, and they signed all the proper paperwork. And then they scheduled the procedure, and it was supposed to be just a short, 30-minute in and out kind of a procedure, no problem. So they bring their daughter to the eye clinic. This was in Atlanta area. And they put her into a exam room and put the drapes around her. And the nurses are reassuring her and making her laugh and telling her everything's going to be okay. And then they wheel her back into the surgical suite. And when they get her back to the surgical suite, there's a team involved for her care. There's the surgeon who's going to be actually taking the little skin growth off. And then there's an anesthesiologist whose job it is to put the patient, the young woman, under anesthesia. And then there's a circulating nurse that's present to make sure people get the right instruments and those types of things. Well, they go in for the procedure, and the anesthesiologist administers oxygen to the patient and propofol, which is an anesthetic or a sedative. And they put the little girl to sleep. Well, the doctor cuts off the bleb or the little growth and then reaches for an electric cautery device. This is a electric device that creates a spark, and doctors use this to stop bleeding at sort of localized areas. And the doctor reaches for the cautery and goes to cauterize the little bleeding around on the eyelid. And when he does this, a fireball erupts and spreads across the little girl's face and catches fire to the hairnet that they put on patients, as well as the cloth materials around her. And they throw water on her face. They put the fire out. The patient is still unconscious from the anesthesia. And the doctor examines her eyes. Fortunately, there did not appear to be any burning to the cornea or to the structures of the eye. But her face was just a bright red from this fire. They take her into the PACU, or the post-anesthesia area, to bring her out of anesthesia. And when she comes out of anesthesia, her face is on fire, feels like it's on fire, and she's screaming and she's crying. What happened? What happened? It hurts, it hurts, it hurts. They go to the parents and explain that a fire broke out and caused your daughter to be burned. And the parents are understandably angry and insist that their daughter be transferred to another hospital. This is not a hospital. This was a procedural clinic. And they do. They take her to Kennestone, the burn center over there. And the very wonderful medical doctor, the burn specialist, examines her and realizes that she has what are known as second degree and possibly third degree full thickness burns on her face, her ear, the side of her face, even down towards her jawline. And the parents are like, you have got to be kidding. How did this happen? And they're outraged by this, understandably. And over the next 3 to 6 months, their daughter had to have another surgery to put skin grafts on her face to try and mitigate or reduce the scarring. This was during the time of COVID. So she was isolated from her friends, but then had to wear this sort of sock over her entire head to protect the stitches and the recovery from the second surgery. And the little girl just went through a truly horrible experience. And the parents came to me and they said, we don't know what happened. Nobody's really explained this to us, but we brought her in there for this elective procedure to have this, essentially this bump taken off. And the next thing we know, our little girl had this horrible injury. It's affected her personality. She's fearful. She has nightmares. And they just wanted answers. They wanted to find out why this happened. And if there was negligence, which they assumed there was, I mean, you don't expect a fire to break out in an operating room. They wanted to know why this happened. And that's how the case came to me. What I did not expect is that we would go on a journey that would lead us to discover multiple system failures at this eye clinic, as well as lying, cover up, altered records, which I'll get to in just a minute. It's like something off a Netflix series. I did not anticipate any of that, but we dug in and this is what we found. And I learned that surgical fires are well known in the area for people who do surgeries where there is pure oxygen and there's any kind of a cauterizing device, any kind of electrical device that creates a spark. I learned that you have to have 3 elements, what they call the fire triad or the fire triangle. You have to have 3 things come together for fire to break out in an operating room. You have to have heat, obviously. There has to be a fuel source, and then there has to be oxygen. And this is sometimes called an oxidizer. But in an operating room, oxygen and nitrous oxide are used to anesthetize a patient. And most surgical fires occur in an oxygen-enriched environment when the concentration of oxygen exceeds 30%. And so for some perspective, the normal concentration of oxygen in a room is about 21%. That's just room air, we call it. But when supplemental oxygen is given to a patient in an operating room, then an oxygen-rich environment is created. Well, why do you give supplemental oxygen to a patient in an operating room setting? Well, one reason is because when you're giving propofol, which puts you into deeper sedation, it can reduce the patient's ability to breathe. So typically the anesthesiologist will kind of deliver pure oxygen to the patient to get all that oxygen into their system. So if they do lose some ability to breathe from the propofol, they'll have a backup. It's kind of like filling up the reserve tank. They deliver the oxygen through these nasal cannulas or a face mask. So the oxygen's going to the patient. The surgical team all knows that a fire is a possibility. So it's incredibly important to communicate between the anesthesiologist, the doctor, and the circulating nurse. And what we learned in this case is that the anesthesiologist had delivered and created this oxygen-rich environment, but she claimed that she was not aware that the doctor was going to use a cautery device. Of course, the doctor's response was, I use it all the time. This is how I do my procedures. This was a new anesthesiologist. She had never worked with this doctor before. They didn't talk about this ahead of time. So it was kind of sort of this perfect storm created by people making assumptions and not communicating with each other. So we fast forward into the surgery. The anesthesiologist has created this oxygen-rich environment. And then when the doctor went to reach for the cautery device and turned it on, it looks like sort of a pin. It sparks at the end. And if you put it towards the skin, it'll cause the skin to essentially burn, but or they call it cauterize and stop the bleeding. And when he reached for it, the anesthesiologist apparently didn't realize he was going to do that. And when he turned that device on, it ignited that oxygen-rich environment and set fire to the drapes and the hairnet. And this led to a fire along this young woman's face. We filed suit. We had the case reviewed. This is sort of our typical procedure. We got all the medical records together. We got the story from the client and got as much information as we could from the client. And then we sent it out to a surgical expert that we hired to look at the records. We sent it out to nurses, and everybody said the same thing, that this should never happen. You should never have a fire breakout in an operating room. It's a never event. It's like, operating on the wrong leg or taking off, amputating the wrong finger. It should never happen. So we took that information, we prepared a lawsuit, we filed a lawsuit against the eye group as well as the anesthesiologist. And we set off to answer the question, why did this happen? We knew what happened, but we wanted to know why it happened. And the why question in medical malpractice is so important because that exposes the system failures. It exposes the failings, the bad choices, the bad policies, the things that lead to the bad event. So we set out for discovery. And the first thing we did after we gathered all the medical records is we deposed the surgeon and we deposed the anesthesiologist. We took their deposition and put them under oath, and we asked them what happened. And the surgeon was pretty forthcoming. I mean, he acknowledged that. He says, yeah, I always use a cautery. I assumed that the anesthesiologist would realize that. I mean, how else are you going to stop the bleeding was his point. But he was forthcoming. He didn't try to hide anything. Well, then we get to the anesthesiologist, and we asked her what happened. And she said that she reduced the oxygen level. She doesn't know why there was a fire. And she sort of pointed fingers at the surgeon and said, well, he didn't really tell me he was going to use a cautery. And how would I know that? I'm an anesthesiologist, I'm not a surgeon. And he should have told me. So it's kind of a finger pointing. Well, she should have told me and he should have told me. And, nobody really fully accepting their accountability. So I asked the anesthesiologist, I said, well, I've looked at your anesthesia records and they're all handwritten. These are records that the anesthesiologist keeps in real time. So if you can imagine, she's typically sitting close to the patient near a machine, monitoring the dials on the machine and looking at the screen and making sure everything is as it should be. And she testified that she had the oxygen at the right level. She reduced the oxygen at the right level, down to the right level before the cautery was used. And she denied knowing or understanding how this fire happened. And I remember asking her at her deposition, I said, well, did you ever go back and change your record or alter your record in any way? And she testified under oath, no, I've never done that before. Foreshadowing, because we'll get to that in a second. But that's what she testified. So I was suspicious. I've got sort of a suspicious nature being in this business and seeing so many different attempts to mislead and misdirect and hide evidence. And I suspected something was funny about her anesthesia records. So I hired a professional document examiner. And this gentleman, highly trained, a lot of experience, came out of the military criminal investigative division and has specialized equipment to look at medical records or to look at any documents. Typically, since he was out of the military, he went to work for civilian law enforcement and would examine, fraudulent documents, signatures, the type of ink that's used. I mean, he could tell all kinds of information. And I got access to the original anesthesia records, and I asked him to examine them and see what they showed. Well, he examined them, and what he learned was he got the documents and he sent different wavelengths of light through the paper. And from doing that, he could tell that two different types of ink were used in these anesthesia records. And then he took pictures of what that looked like. So you could see the original record that with the original pen, and then you could see that the anesthesiologist had overwritten what she had written before. She had changed what was a 3 showing 30%, which is too high. She had changed that to make it look like a 1. And it was the same color ink, but this document examiner was able to demonstrate that it was a different pen. It was a different type of ink. And you could see it very clearly how the ink flowed onto the paper. With the two different pens, it had a different flow pattern that was very obvious once it was pointed out. And he showed that she had altered this record to indicate that the oxygen had been at 100%. She altered, I think I had that backwards earlier. She altered to make it look like 30%, which would have been within the standard of care. But 100% at the time the procedure started would be outside the standard of care, would be professionally negligent. Apparently, she realized this at some point, and she went back with a separate pen and altered the record. Well, let that sink in for a moment. A doctor is responsible, at least in part, for causing a surgical fire that caused permanent scarring and burns to a child. And this doctor went back in and intentionally altered her medical record to cover up what happened and to protect herself. And this is, in my mind, one of the most important aspects of these types of cases is to expose that type of misbehavior. She's still practicing. The family does intend to file a formal complaint with the medical board, but she still practices, even though she was discovered to have done this. But it won't surprise anybody listening to this that once we discovered this evidence and brought this to the attention of the defense, all of a sudden there was an interest in trying to get the case resolved. And they started talking to us about settlement, and we were able to engage in settlement discussions and get the case resolved for a confidential amount. And that's what the family wanted to do. What I wanted to do, if it was up to me, of course, do what's best for the family. But this is obviously the kind of thing that juries do not appreciate and do not accept, and they typically respond to such efforts of deception with significant verdicts. The defense realized that, which was very clear to me, and they engaged us in meaningful discussions. We were able to get the case resolved. There's not really a happy part to the story, but there is a happy outcome that this little girl recovered very, very well from where she was. The burn doctor at Wellstar Kennestone was concerned that she would have permanent scarring. Sometimes the scarring can keloid or raise up and be permanently disfiguring. But this little girl was very fortunate that her skin was resilient. She is very resilient, one of the bravest clients I've seen in a long time, particularly a young person. And she recovered very well. And the family was pleased with the outcome. They were pleased that they would not have to put her through the trauma of a trial. And I explained to them what that process would look like. And they were concerned about her being on the stand, a jury, having to present to a jury. And I appreciated this as a parent myself. There's no greater instinct than trying to protect your child. And they felt like she had been through enough, and that the defense had finally acknowledged with their actions and with their settlement their negligence and their culpability in this case. So we were able to resolve this case. And the takeaways that I took from this, I learned from every one of these cases, even if I've seen the medicine before in a different setting or in a different context. I learned from every one of these cases. And in this case, really underscored how important systems are in place to keep patients safe. Things like this don't happen just because somebody makes a mistake, or that's very rare. Things like this happen because there aren't systems in place to protect patients. And the system that should have protected this little girl, and that is the standard of care, is that before the healthcare professionals even walk in there to start the process, they're supposed to have a huddle or have a meeting together before the procedure and discuss the risk of fire specifically. And they're supposed to discuss how much oxygen are you going to use, what type of machinery or devices are you going to use, are they going to create a spark? All that is supposed to be discussed before the surgery. In this case, people got complacent and did not have that kind of discussion and just assumed everybody knew what they were doing and everybody was going to do the right thing. And that assumption is what ultimately led to this fire and to this lawsuit. But the conclusion is that this little girl's doing very well in school. She's a theater kid, which I was accused of being a theater kid when I was coming along, and I never took it as an insult. I love the theater and love everything about it. And it was she and I spent a lot of time together and sort of bonding over her interest in theater and her dreams for being on stage and living a life. And it's very rewarding to see her doing so well and doing all those things that a teenager should be doing at this point. So this is a case that will stay with me for a long time. And it also reinforced, the importance of trusting your instincts. And if it feels like somebody, may not be either telling the truth or may be altering a record, listen to that sort of instinct and investigate. And that's what led to a successful outcome of this case. Thank you for joining us today on Face the Jury. This episode is the conclusion of our season 5, and we are already looking forward to and planning for season 6, which should be coming out in the next few months. Thank you again, and we look forward to seeing you on Face the Jury.